feel like you have a barbed wire tighten on your skin, and it's like this.
Shingles affects an estimated 1 million people in the United States each year, and the coinciding rash is known to cause severe discomfort. For most people, when the rash leaves, the pain goes with it, but for some, the pain persists long after their skin has cleared. It's called Postherpetic Neuralgia, or PHN, and it develops as a result of nerve damage that occurs during the shingles outbreak. PHN affects about 10 to 15% of people, and the risk increases with age. Here at NYU Langone Health, Dr. Christopher Garibo treats a variety of patients with chronic pain, and for those with PHN, the road to relief can often be a long one.
The patient that's most likely to get PHN or postherpetic neuralgia is a patient that's been poorly treated during the acute phase of the disease. So during the acute herpes zoster, if they are not bringing their pain under control through an antiviral therapy, through good medical management, and through good pain control, they're going to damage that nerve during that time. Those symptoms correlate to the distribution of a nerve. So that could be any of the nerves that comes out from the spinal cord, I would say from the face to the toes. But most of the time it occurs in the chest, what we call the thoracic area or the abdominal area. It's something that is disabling, and the symptoms that the patient feels is the sharp stabbing, burning, non-positional, non-activity related pain that's there no matter what. You can't come off the pain.
In 2014, Arissa came down with a painful case of shingles. She never expected that the pain would return even after the rash went away.
The pain is kind of on the surface. It's hurt to the touch sometimes, but when it is really painful, it feels like you have a barbed wire tighten on your skin, and it's like this. It's been 5 years, but after the rash, I still have the pain. First, I thought the pain would go away soon. It never went away, and the pain is more intense, actually, than the rash itself. And it's just there every day.
For some people, PHN can be difficult to manage and often takes a combination of treatments to reduce the pain.
For the pain, I have medication. Doctor prescribed me nerve pain medication. It didn't help, so I look outside. I try essential oil, but no matter what I use, it doesn't make it go away.
So treatment of postherpetic neuralgia starts with patient education and expectation setting, and telling the patient about the different types of medications that are available to treat the different pains that patients with PHN are experiencing. There are medications that are systemic, so what I mean by that is medications that are taken orally. So that can range anywhere from anticonvulsants, antidepressants, to opioids. Then there are also peripheral medications, such as topical delivery systems that are available. Most of them are in the form of patches that go directly on the skin over the area that is painful. And what that category aims to do is that they dial down the sensitivity of the peripheral nervous system. So the nerves that are causing the pain at the periphery, let's say at the chest wall, that are producing all that nerve sensitivity and burning and electrical sensations are quieted down directly. And as that quiets down, the spinal cord also secondarily quiets down as well. So that can be effective as well. Very safe, probably much safer than anything systemic, such as opioids or anticonvulsants, and do not need to be titrated to effect.
For patients with long-term chronic pain due to PHN, having non-invasive options for patients' relief is paramount. Dr. Garibo explains.
So with any medication category, obviously we're focusing on efficacy and safety, but there's also tolerability as well as practicality there as well. So when it comes to, for example, prescribing opioids, they are quite efficacious. There's safety concerns, tolerability concerns, there are dependency concerns, and so on and so forth. So it may be appropriate in a very small subset, but generally speaking, they're not in a great subset. Patches are definitely the safest category. They can be effective for a whole range of intensities of neuropathic pain, of postherpetic neuralgia. The contraindications for them is if the patient is allergic to lidocaine or to the components that are used for the adhesion of the patch. But generally speaking, they're well tolerated and there's good patient acceptance towards the patch because they tend to provide cleaner pain relief.
Some patients have reported adhesion problems with traditional over-the-counter or other prescription patches, leaving some patients still looking for relief.
I tried different patches, but it doesn't stay long. It doesn't stay on, it peel off too quickly. So I stopped using that too.
So the biggest difficulty that we've had with lidocaine delivery systems is the fact that many of them do not stick well. Patient constantly has to sort of adjust the patch, re-stick the patch, press on the patch so that it stays on the body. And they tend to give up on it after a while because it just tends to be frustrating, it tends to interfere with the patient's day, and at some point they just give up on the technology.
ZTLIDO uses an advanced adhesion technology to optimize the delivery of lidocaine for patients suffering from post-shingles pain and is up to 3 times more adhesive versus some generic lidocaine patches and is proven to remain in place for a full 12 hours, even during moderate exercise.
So the lidocaine delivery systems in the marketplace vary in terms of the duration that they're applied, but generally speaking, they're 12 hours on, 12 hours off, up to 3 patches a day. So the end point is really having the patch stay on, not so much how much lidocaine is in the patch, but how efficient is the delivery system and how good is the adhesive qualities of the patch and how flexible is the patch so that it can stay on.
ZTLIDO provides more efficient lidocaine delivery than 5% patches over a full 12 hours by using less total drug to deliver the same amount of lidocaine. Topical lidocaine systems are now being recommended as a first-line treatment for the relief of pain associated with PHN.
So my doctor recently prescribed me ZTLIDO patch, and I find that it stays on longer, and it does help me throughout the day with the pain.
If you do happen to get the virus reactivating and it causes extensive nerve damage, and now you're left with neuropathic pain of postherpetic neuralgia, tell your doctor about the pattern of the pain. Is the pain constant? Is it intermittent? What is the character of the pain? What is the effect on your social life, on your occupation? Give them an understanding of the magnitude that the pain has on your lifestyle. And that's extremely important because the end point for the physician is to ultimately improve your function in a way that's clean and effective.
For more information on ZTLIDO lidocaine topical system, go to this website, ztlido.com, or check out our website, thebalancingAct.com.